Guys, this is Lily and welcome to my YouTube channel. In this video, I'm going to discuss with you some massage therapy contraindications, and this may be helpful for you in your massage therapy practice. So contraindication, or CI, is defined as a symptom or circumstance that makes a treatment inadvisable. So in massage therapy, a contraindication may be absolute, meaning massage is an inappropriate method of treating a condition that affects either the whole body or a part of the body. So massage therapy contraindications can be categorized into absolute contraindications, which includes some general conditions, which means that massage therapy is not appropriate for a client with the following conditions. So these are the general conditions that are not appropriate for a client to have a massage therapy treatment. Okay, so one is acute conditions requiring first aid or medical attention. So an example of this is acute seizure, which is a seizure in a sudden, uncontrolled electrical disturbance in the brain, and it can cause changes in your behavior, movements, or feelings, and in levels of consciousness. Okay, so another one is anaphylaxis. It is a serious allergic reaction that is rapid in onset and may cause death. It typically causes more than one of the following: an itchy rash, throat or tongue swelling. So for anaphylaxis, there's also shortness of breath, vomiting, lightheadedness, low blood pressure, and temporary blindness. So another condition is appendicitis, which occurs when the appendix becomes inflamed and filled with pus. Okay, so it is an inflammation of the appendix, a finger-shaped pouch that projects from your colon on the lower right side of your abdomen, and appendicitis causes pain in your lower right abdomen or abdomen. Next is atelectasis. It is a complete or partial collapse of the entire lung or area or lobe of the lung. Okay, it occurs when the tiny air sacs, the alveoli, within the lung become deflated, or possibly filled with alveolar fluid. So there's fluid in the alveola. Okay, so atelectasis is one of the most common breathing or respiratory complications after surgery. There's the cerebrovascular accident, commonly called CVA, which is the medical term for a stroke. A stroke is when blood flow to a part of your brain is stopped either by a blockage or the rupture of a blood vessel. Next is the diabetic coma. It is a life-threatening diabetes complication that causes unconsciousness. If you have diabetes, dangerously high blood sugar, hyperglycemia, or the dangerously low blood sugar, which is hypoglycemia, can lead to a diabetic coma. Okay? Next is insulin shock. It is a common term for a low blood sugar or hypoglycemia. It may also be called an insulin reaction. The exact level that leads to symptoms varies, but is generally less than 70 mg per dl. A low blood sugar level triggers your body to release the hormone epinephrine, also called adrenaline, your fight and flight response. Okay, next is the myocardial infarction, which is MI, also known as a heart attack. Occurs when blood flow decreases or stops to a part of the heart, causing damage to the heart muscle. The most common symptom is chest pain or discomfort, which may travel into the shoulder, arm, back, neck, or jaw, or your jaw. Next is pneumothorax. It is an abnormal collection of air in the pleural space between the lung and the chest wall. Symptoms typically include sudden onset of sharp, one-sided chest pain and shortness of breath. Okay? Next is the severe asthmatic attack. The symptoms of a severe asthma attack can include severe shortness of breath when you experience difficulty speaking, rapid breathing where your chest or ribs visibly have retractions, or straining your chest muscles and working hard to breathe. Okay? So next, the status asthmaticus is a long-lasting and severe asthma attack that does not respond to standard treatment. It occurs when asthma symptoms like difficulty breathing, wheezing, and coughing fail to improve with emergency medicine treatment. Status asthmaticus is an emergency that can lead to death. Next is syncope or fainting. It is a temporary loss of consciousness usually related to insufficient blood flow to the brain. It is also called fainting or passing out. It most often occurs when blood pressure is too low, which is hypotension, and the heart doesn't pump enough oxygen to the brain. So all of those I mentioned previously are medical conditions that require first aid or medical attention. So when you encounter these problems with a client, you don't do a massage therapy on them. They need an emergency medical attention. So you're gonna send these clients right away to the hospital or to see the doctor. Okay. Next, general condition that require absolute contraindication, meaning no massage therapy for this condition, is the acute pneumonia. Okay, so pneumonia is an infection that inflames the air sacs in one or both lungs. So the air sacs may fill with fluid or pus, a purulent material like a mucus, causing cough with phlegm or pus, fever, chills, and difficulty breathing. A variety of organisms, include bacteria, viruses, and fungi, can cause pneumonia. Okay, so next is the advanced kidney failure, or advanced respiratory failure, or liver failure. So this is also a general contraindication. Now, a very modified treatment may be possible with medical consent. Take note of this, guys, okay? So let's just discuss about advanced kidney failure. So advanced kidney failure is the end stage in renal disease. Renal means pertaining to the kidney. It's also called end stage kidney disease, okay? So it occurs when chronic kidney disease. Chronic means repetitive, okay? It's been there for a long time. The gradual loss of kidney function reaches an advanced state. Here you go, guys. So when it's reached to an advanced state, that means it's towards the end stage. It's towards, there's no more possible of cure. Like, it's difficult to cure this condition. In end stage renal disease, your kidneys are no longer able to work. Here you go, guys, as they should to meet your body's needs. Okay, this is very dangerous at this point. Okay, so with regards to respiratory failure, it means that it is a serious condition that develops when the lungs cannot get enough oxygen into the blood. So buildup of carbon dioxide can also damage the tissues and organs and further impair oxygenation of blood, and as a result, slow oxygen delivery to the tissues. So if we compare it to the advanced respiratory failure, it is also the end stage respiratory disease and the gradual loss of respiratory function that reaches an advanced state. Okay, so that's the end stage. That means there's no more, you can no longer be able to work the respiratory organs, and they cannot meet your body's needs with regards to respiration. Okay, the function of the respiratory organs. Now, next is the diabetes with complications such as gangrene, advanced heart or kidney disease, or very unstable or high blood pressure. So this is also a general contraindication for massage therapy treatment. So just to discuss about diabetes mellitus or mellitus, which is commonly known as diabetes. It is a metabolic disease that causes high blood sugar. Okay, the hormone insulin moves sugar from the blood into your cells to be stored or used for energy. With diabetes, your body either does not make enough insulin or cannot effectively use the insulin it does make. So that's when complications come in, such as gangrene, like dead tissues in an area, advanced heart disease or kidney disease, okay, and a very unstable high blood pressure, because when you have this gangrene, problem in an area, that means blood flow cannot go through the area, so and it's being stuck, it cannot distribute blood and nutrients to other areas in the body, and that's when you have this complication of unstable or high blood pressure. Okay, it's not the distribution of blood is no longer normal because of the in diabetes problem. Okay. For eclampsia is another general contraindication. It means a severe complication of pre-eclampsia, before eclampsia. Okay, so pre is before. It is a rare but serious condition where high blood pressure results in seizures during pregnancy. So mostly this happens during pregnancy. Seizures are periods of disturbed brain activity that can cause episodes of staring, decreased alertness, and convulsions like violent shaking. Next is we have hemophilia. It is a rare disorder in which your blood doesn't clot, normally because it lacks sufficient blood clotting proteins, the clotting factors. And if you have hemophilia, you may bleed for a longer time after an injury than you would if your blood clotted normally. So this is a general contraindications, guys. It's very scary. Okay, so this is a condition to consider while performing massage therapy. So this is a general contraindication. This is no massage for this kind of condition. Okay, next is hemorrhage. Hemorrhage is an escape of blood from a ruptured blood vessel, especially when profuse. So there's a lot of blood coming out from an area, okay, in your body. So this is very dangerous. So another is post cerebrovascular accident or post myocardial infarction, where the condition has not stabilized. So this condition is happens after a cerebrovascular accident or a myocardial infarction condition or accident. Okay. So for cerebrovascular accident, the CVA, it is a medical term for a stroke. So after a stroke, then you can have this post-cerebrovascular accident consideration. Okay, so take note of these guys. When a stroke is when blood flow to a part of your brain is stopped either by a blockage or the rupture of a blood vessel. Okay, and like I said, post means after or later or subsequent to. So when a stroke happens, so after that you have to consider, if a client tells you that he or she had a stroke, then you have to ask some questions to determine if when this stroke happened, because like we mentioned here, after a stroke or a cerebrovascular accident is a no-no for massage therapy, because the condition of a client has not been stabilized, or like a myocardial infarction, a heart attack. This means heart attack. After a heart attack, you need to consider, when a client comes to you telling you about, he or she had a heart attack before, or a myocardial infarction condition previously, you need to ask some questions of how long, and you need to consider not doing the massage therapy, because pretty much the condition has not been stabilized yet. Okay, so be careful. Next is severe atherosclerosis. Sclerosis means hardening. Okay, so atherosclerosis is a disease in which the inside of an artery narrows due to the buildup of atheromatous plaque. Okay, initially there are generally no symptoms. When severe, it can result in coronary artery disease. It affects your coronary artery, which is located by the neck area, close to your head. Stroke, peripheral artery disease, meaning peripheral, your arteries down your limbs, okay, away from the CNS, your spine and your brain area, okay. Or kidney problems, affecting kidneys, depending on which arteries are affected. Okay, atherosclerosis is hardening or narrowing of the arteries. Okay, if it's severe, then it's gonna be worse. So it's not only a mild case; it's a severe case. Okay, so you need to be considering this and be careful in dealing with clients with this condition. Okay. Next is the severe undiagnosed headaches in those over 50 years of age. So guys, if you have a client in massage therapy that is over 50 years of age and complaining of headaches that has been there on and off, severe headache, okay, and if you find out that it's undiagnosed, then you have to be careful, because severe undiagnosed headache is defined as an intense, not diagnosed pain arising from the head or upper neck of the body. Okay, the pain originates from the tissues and structures that surround the skull or the brain, because the brain itself has no nerves that give rise to the sensation of pain or pain fibers. So guys, be careful when you are able to deal with clients having undiagnosed headaches, chronic, severe, then you have to be careful, because this is a general contraindication to massage therapy treatment. Okay. Next is a severe unstable hypertension. Okay, hypertension, short for HTN or HT, also known as high blood pressure or HBP. It is a long-term medical condition in which the blood pressure in the arteries is persistently elevated, so high, okay, higher than normal. Severe and stable hypertension means an intense and not stable hypertension condition. Okay, so be careful. This is a general condition. When a client comes to you for massage treatment complaining of hypertension, then you need to ask a couple of questions of how severe, or if they have been taking medication for this high blood pressure or hypertension, and you need to be modifying, or if it's severe, then you need to, or unstable, then you don't need to do the massage. This is a general contraindication. Okay, if it's unstable, meaning there's no medication, the client has not been taking any medications for their hypertension. Okay. Next is shock. Shock is the state of insufficient blood flow to the tissues of the body as a result of problems with the circulatory system. Circulatory system, which involves the blood or the blood flow. Okay. And the initial symptoms of shock may include weakness, fast heart rate, fast breathing, sweating, anxiety, and increased thirst. Okay, so be observant. This is a general contraindication, no massage for this condition. Next is a significant fever from 38.5 degrees Celsius and 101.5 degrees Fahrenheit. Okay, so fever. Although a fever technically is any body temperature above the normal of 98.6 Fahrenheit or 37 centigrade or Celsius, in practice, a person is usually not considered to have a significant fever until the temperature is above 100.4 Fahrenheit or 38 Celsius. So, as I said, it could be from 38.5 degrees Celsius and 101.5 degrees Fahrenheit, which is above the levels as we mentioned. Okay, so you need to be careful when a person has fever. Then it's a no-no. It's a contraindication right away for any massage treatment. Take note of that. Okay. There are some highly metastatic cancers not judged terminal. Okay, so let me just discuss. Metastatic cancer is a cancer that has spread from the part of the body where it started, or the primary site, to other parts of the body. So when cancer cells break away from a tumor, they can travel to other parts of the body through the bloodstream or the lymph system. Okay, through the blood or the lymph fluid. Okay, so that it metastasizes. Okay, it travels to other cells, the cancer cells. All right, so highly metastatic cancers can spread to a high degree or level from the part of the body where it started, the primary site, to the other parts of the body. Okay, highly metastatic cancer cells. Okay, so for terminal cancer, it is a cancer which cannot be cured and is not responding to treatment, and that the person is likely to die from. Any kind of cancer can become terminal. Okay, so that's when terminal is explained here, when it says some highly metastatic cancers are not judged terminal. Okay, so you have to be careful. Right? So if somebody has a cancer and it is judged as highly metastatic, then you should be careful. It's a general contraindication. Next is the systemic, contagious, or infectious condition. So let me just explain the terminologies here. So for systemic, it means affecting the entire body rather than a single organ or body part. So it's all the body system, pertaining to the system, the whole body system. For example, systemic disorders such as high blood pressure or systemic diseases such as the flu affect the entire body. An infection that is in the bloodstream is also called a systemic infection. It affects the whole body. Okay? So contagious disease such as the flu, colds, or strep throat spread from person to person in several ways. Contagious spreads to one person to another. Okay, one way is through direct physical contact, like touching or kissing a person who has the infection. Another way is when an infectious microbe, okay, travels through the air after someone nearby sneezes or coughs. So today's guide, one good example of this is the COVID-19 virus. Okay. Now, infectious diseases are caused by microscopic germs such as bacteria or viruses that get into the body and cause problems. So some, but not all, infectious diseases spread directly from one person to another. Infectious diseases that spread from person to person are said to be contagious. So here you go, guys. It's the meaning of the contagious condition. Okay. Now, sometimes people get contagious diseases by touching or using something an infected person has touched or used, like sharing a straw with someone who has mono, or stepping into the shower after someone who has athlete's foot. And sexually transmitted diseases, STDs, are spread through all types of sex, oral, anal, or vaginal. Okay, so these are contagious diseases. Systemic, it affects the whole body. Okay. Okay, let's go to the local conditions that are a contraindication to massage therapy. So for local contraindications, massage therapy is not appropriate locally for any of the following conditions. So the following are the conditions or diseases that are under the contraindications for local conditions, under local conditions for massage therapy treatment. Okay, so one is the acute flare-up of inflammatory arteritis. So the examples of this are the rheumatoid arthritis, the systemic lupus erythematosus, the ankylosing spondylitis. There are other inflammatory arthritis conditions that are also under this level. Okay, so the contraindication may be general depending on the presentation. Okay, so be careful, be mindful of this. Okay, if it's local, then it is contraindication under local conditions. Right. So next is acute neuritis. So neuritis is an inflammation of a nerve or the general inflammation of the peripheral nervous system. Okay, peripheral away from the central nervous system. Okay, towards the limbs. Okay, inflammation and frequently concomitant demyelination cause impaired conduction of neural signals and leads to aberrant nerve function. So acute means sudden, neuritis, neuro means nerve, and itis means inflammation. So in short, it is inflammation of any nerve, a sudden inflammation of any nerve. Okay, all right. Next is the acute trigeminal neuralgia. Okay, trigeminal neuralgia is a chronic pain condition that affects the trigeminal nerve, which carries sensation from your face to your brain. There you go, guys. If you have trigeminal neuralgia, even mild stimulation of your face, such as from brushing your teeth or putting on makeup, may trigger a jolt of excruciating pain. Okay, so acute, again, sudden trigeminal neuralgia is pain. Algia is pain on the affecting the trigeminal nerve. Okay, it is a nerve that carries sensation from your face to your brain. Next is the aneurysms, which deemed life-threatening. So an aneurysm refers to a weakening of an artery wall that creates a bulge or distension, expansion of the artery. Okay, most aneurysms do not show symptoms and are not dangerous. However, at their most severe stage, intense stage, some can rupture, leading to life-threatening internal bleeding. Okay, example, the abdominal aorta. Okay, the contraindication may be general depending on the location. Okay, take note of this, guys. Next is deep vein thrombosis or thrombophlebitis or arteritis, right? May be general condition if located in a major circulatory vessel, okay? And for deep vein thrombosis, which is DVT, it occurs when a blood clot, the thrombus, forms in one or more of the deep veins in your body, usually in your legs. Okay, deep vein thrombosis can cause leg pain or swelling, but also can occur with no symptoms. Be careful, right? Thrombophlebitis is a phlebitis or inflammation of the vein related to a thrombus, the blood clot. Okay, in terms of complications, one of the most serious occurs when the superficial blood clot is associated with a deep vein thrombosis. The thrombosis. So, thrombophlebitis can be found in people with vasculitis, including Behçet's disease. Vasculitis, inflammation of the vessels. Okay, so thrombophlebitis, inflammation of the vessels caused by thrombus, the blood clot. So be careful. If you encounter a client with deep vein thrombosis, you don't have to do the massage therapy. You need to send the client to see a doctor or to the hospital. It's an emergency. Next, the arteritis refers to inflammation of your arteries that damages your blood vessel walls, and reduces blood flow to your organs. There are several types of arteritis. The symptoms and complications can occur depend on which arteries are affected and the degree of damage. So inflammation of your arteries. That's what it means. Okay, so next, the ectopic pregnancy, which means it is a condition in which a fertilized egg settles and grows in any location other than the inner lining of the uterus. Okay, the vast majority of ectopic pregnancies are so-called tubal pregnancies and occur in fallopian tube. Here you go, guys. So we also have the esophageal varicositis. Esophageal varices, for example, are abnormal. Enlarged veins in the tube that connects the throat and stomach, the esophagus. This condition occurs most often in people with serious liver diseases. Okay, esophageal varices develop when normal blood flow to the liver is blocked by a clot or scar tissue in the liver. Now, for varicositis, it means they are abnormally dilated and tortuous veins that usually appear in the lower extremities. Okay, varicositis in general occur as a result of an underlying problem with reverse venous flow, also known as venous insufficiency syndrome. So this esophageal varicositis, as I explained already, it happens in the esophageal area. Okay, those enlarged veins that connects the throat and stomach, the esophagus. Okay, so inflammation or problems in this area. Next, the frostbite. It is an injury caused by freezing of the skin and underlying tissues. First, your skin becomes very cold and red, then numb, hard, and pale. Frostbite is almost common on the fingers, the toes, nose, ears, your cheeks, and chin, or your chin. Exposed skin in cold, windy weather is most vulnerable to frostbite. So be careful, guys. So when you see a client having these symptoms, if you see this on their extremities, then it's a local contraindication. You don't have to massage this client. Okay. Now, next is the local contagious condition. A contagious disease is a subset category of transmissible diseases which are transmitted to other persons either by physical contact with the person suffering the disease or by casual contact with their secretions or objects touched by them or airborne route among other routes. Okay, local means a characteristics of or associated with a particular locality or area. So, local contagious conditions. Any contagious disease that is locally or in one area. Okay, if you happen to see this with a client, then that area is a local contraindication. That means you don't massage the area. Okay, next, the local irritable skin condition. Okay, so irritable skin, let's just define this, means itchy or sensitive skin, and the causes of itchy skin include skin conditions. Okay, many skin conditions itch, including dry skin like cirrhosis, eczema, dermatitis, psoriasis, scabies, burns, scars, insect bites, and hives. Local means, again, a characteristic of or associated with a particular locality or area. So if a client is complaining of a sensitive, itchy, or irritable skin on part of the client's body, then you don't have to massage the area. It's a local contraindication. Next is malignancy, especially if judged unstable. Okay, malignancy means the state or presence of a malignant tumor or cancer. Then after biopsy, evidence of malignancy was found. Okay, so if a client comes for a massage treatment and tells you that she has this area of like a tumor, or she has a cancer, and there's a state of malignancy, and it's not judged, if it's judged unstable, then it is a local contraindication. Okay, so no massage locally on the area. So be careful. Okay, next is open wound, sore, decubitus ulcer. A decubitus ulcer is also known as a pressure ulcer, pressure sore, or bed sore. It is an open wound on your skin. Decubitus ulcers often occur on the skin covering bony areas. Okay? An open wound is an injury involving an external or internal break in body tissue, usually involving the skin. Nearly everyone will experience an open wound at some point in their lives, so most often wounds are minor and can be treated at home. Sore is a raw or painful place on the body. Okay, so if you are treating a client with an open wound or sore area, or has a decubitus ulcer, which is a wound or a bed sore, that is pretty much in the bony areas, then this is a local contraindication. No massage on the area. Now, next is the pain syndromes such as causalgia or reflex sympathetic dystrophy. Okay, so causalgia is technically known as complex regional pain syndrome type 2, CRPS2. It is a neurological disorder involving nerve that can produce long-lasting intense pain. CRPS2 arises after an injury or trauma to a peripheral nerve away from the central nervous system, the brain and the the brain and the spinal cord area. Okay, so peripheral nerves run from your spine and brain to your extremities. Okay, so the reflex sympathetic dystrophy syndrome, RSD, is a disorder that causes lasting pain, usually in an arm or leg, and it shows up after an injury, stroke, or even heart attack. But the severity of pain is typically worse than the original injury itself. Okay, so these are two pain syndromes, types of pain syndromes, and if you happen to encounter a client for massage therapy that has these conditions, then this is a local contraindication. Okay, so you need to consider this. Okay, next is the radiation therapy site both during and up to several weeks post-radiation therapy. Okay, physician's consent is important here. Okay, so radiation therapy is a type of cancer treatment that uses beams of intense energy to kill cancer cells. Radiation therapy most often uses X-rays, but protons or other types of energy also can be used. The term radiation therapy most often refers to external beam radiation therapy. Okay, the body site for radiation therapy is used to indicate body locations where the radiation therapy is administered. Okay, guys, so when you encounter a client with this problem, telling you that they have he or she has a radiation therapy site, then you need to consider this local contraindication, and you need a physician's consent for this treatment. Okay, if there's nothing, then you have to be careful. It's a local contraindication. Now, recent burn. Now, a burn is a type of injury to skin or other tissues caused by heat, cold, electricity, chemicals, friction, or radiation like sunburn. Most burns are due to heat from hot liquids called scalding, solids, or fire. So if a client comes to your office and complaining of a recent burn, then it's a local contraindication. That area you don't have to massage. Okay, it's a local contraindication. A burn injury is not limited to the skin, but is associated with dysfunction of almost every cell in the body and various organs, leading to alterations not only in cellular functions but also in cellular signaling pathways. Okay, recent means having happened, begun, or been done not long ago or not long before, belonging to a past period of time comparatively close to the present. Okay, so this is the meaning of it. Now, the next is sepsis. It is a potentially life-threatening condition caused by the body's response to an infection. The body normally releases chemicals into the bloodstream to fight an infection. Sepsis occurs when the body response to these chemicals is out of balance, triggering changes that can damage multiple organ systems. So if a person has this sepsis problem, then you need to consider this because it's potentially a life-threatening condition. Okay, so be careful. This is under the local contraindication for massage therapy, but be careful, okay, because this is a life-threatening condition. Next is the undiagnosed lump. A lump is a protuberance or localized area of swelling that can occur anywhere on the body. Other terms used to describe the various types of lumps include bump, nodule, contusion, tumor, and cyst. Lumps can be caused by any number of conditions, including infections, inflammation, tumors, or trauma. Okay, so be careful with lumps. A lump or swelling is a common presenting problem. A lump may also be found by the examining clinician in the course of routine examination. Undiagnosed means not diagnosed, not identified through diagnosis as an undiagnosed illness or lump. So if you encounter a client for massage therapy with an undiagnosed lump, then you have to be careful and consider this as a local contraindication. Okay, just ask a few questions about this problem and you decide whether or not you need to do the massage therapy, and just put this on a local contraindication during massage treatment. Okay, next, the varicositis, which is up to 24 hours post treatment with saline injection. So varicositis, we will discuss, are abnormally dilated and tortuous veins that usually appear in the lower extremities. Okay, varicositis in general occur as a result of an underlying problem with reverse venous flow, also known as venous insufficiency syndrome. Varicositis, the veins, problems with veins. Okay, normal saline is the chemical name for salt. It is a prescription medicine used for fluid and electrolyte replenishment for intravenous administration. Normal saline may be used alone or with other medication. So usually people with varicose veins or varicositis, usually in the lower extremities, the leg area. So if they have undergone this up to 24 hours after the treatment and with that using saline injection, then this area is a local contraindication. So be careful, guys. Okay, you have to be careful about dealing with varicose veins or varicositis during massage therapy treatment. Okay, so note for all, if you have clients who have any of these conditions, please do not book a massage. Okay, number one, if a client has a fever, it's no massage at all. If the client has contagious diseases, including any cold or flu, no matter how mild it may seem, so there's no massage treatment for the client. Okay, and the therapist can massage but not over any areas affected by these problems or conditions. So varicose veins, okay, undiagnosed lumps or bumps, we already discussed this previously, pregnancy, bruising, cuts, abrasions, sore, any cuts, okay, like then abrasions, like I said, sunburn, okay, undiagnosed pain. Okay, so if you encounter these problems, and as a massage therapy, you cannot massage over any of these areas or any of these affected areas. So no massage on these areas. These are local contraindications. Okay, so be careful, guys. Right? So this ends my video, guys. Thanks for watching. You guys continue watching my videos. Please like, comment, share, and subscribe my channel. Have a great day.